Testing for hepatitis C is a very interesting issue and closely related to testing for HIV in a number of ways. So the risk factors for acquiring HIV and hepatitis C are similar for many people, and so people that are at risk for one are frequently at risk for another. Similarly to how the Department of Health and New York State have actually now mandated the offer of HIV testing to patients between the ages of 13 and 64. They have similarly mandated the offer of hepatitis C testing for patients for the baby boomer generation, so patients that were born in a particular age range, because we have found that that population has higher rates than expected of hepatitis C, and most of them haven't yet been tested. So it's now required to offer hepatitis C testing to that population. One of the key differences between HIV testing and hepatitis C testing is this issue of HIV exceptionalism, where HIV testing still requires consent from patients in order to explicit consent from the patient in order to perform an HIV test. The same is not true for hepatitis C testing. And so one of the interesting things that we're beginning to look at is sort of trying to estimate exactly, or trying to quantify what is the impact of requiring consent on HIV testing, because we can compare uptake of HIV testing, which is offered routinely, and uptake of Hep C testing, which is offered routinely, and we see that many more patients are walking out having been tested for hepatitis C rather than HIV, and we think a large part of that gap is actually because of the imposition of requiring consent for HIV testing, which complicates the workflow. Overall, I think everybody is surprised by the rates of undiagnosed hepatitis C. It has been suspected that those rates are out there, that the amount of hepatitis C that we've seen so far is really just the tip of the iceberg, and that the more that we test, the more that we're going to find. And I think the same really goes for HIV testing as well, even though the Bronx is a place that has been subject to public health campaigns stressing HIV testing for the last several years, and even though we've seen increased rates of HIV testing overall among people that live in the Bronx, we find that the more that we test, the more undiagnosed HIV we're actually uncovering. Overall in the Bronx, the prevalence of HIV is about 2%. It's significantly higher than the rest of the city. So I hope to accomplish finding ways that we can effectively expand HIV testing to reach more people, and I hope that by implementing those strategies, we're actually able to uncover more undiagnosed cases of HIV so that those patients can be treated, which is great for them, and we can prevent the forward transmission of the infection to others, because we know that people who have HIV but are unaware of it are more likely to transmit it to other people than somebody who is aware of their diagnosis.